Hi, this is Rich Feifer, Chief Medical Officer of Genesis Healthcare. As of January 11th, the beginning of this week, the CDC reports that just under 9 million people have received the COVID-19 first dose vaccine in the United States. And at Genesis, that number is 21,000. We're making amazing headway in conquering this virus, one vaccine at a time. But while those numbers may seem high, though, we've got a lot more work to do nationwide and in our facilities. The vaccines can only work to put an end to this pandemic if we see high levels of vaccination among ourselves, our peers, and our residents. We all need to be in this together. I received the vaccine and in fact got the second dose last week. And I want to tell you about my experience. I really felt fine after that second dose. My arm was a bit sore, just like it was after the first dose. And I might have felt slightly under the weather the next morning, but that also could have been because I didn't get a good night's sleep. But otherwise, I really was just fine. I'm very excited now that I'm building immunity, and I hope you will too, as you choose to get your first and your second dose, because remember, the second dose is necessary to build the levels of lasting immunity that we all need. So let's go out and get vaccinated.
Hi, I'm JoAnne Reifsnyder, Chief Nursing Officer. Like Dr. Feifer, I also received my second dose of the vaccine. And I need to say that I had even less of a reaction than I had the first time. In my first dose, I had a very mild headache and malaise. I had a sore arm, of course. Second time around, I didn't have a headache, any malaise, no symptoms at all really, but of course, a little bit of a sore arm that's completely resolved now. Some centers are just starting with their first clinics. And for those of you in this group, I'm really grateful that you stood up to take the vaccine and that it's available to you now. And I urge as many residents and staff as possible to participate in the first clinic. And here's why. We've already talked about the vaccine as our way to really get past this pandemic and back to a more normal life. So some centers are starting on their second clinics already. And for those centers, the second clinic is really our first chance we have to ensure that you'll receive your vaccine in a Genesis affiliated center when it's offered. So what does that mean? We expect to have 3 clinics at each center, but at our third clinic, our vaccine partners, CVS and Walgreens, will not offer any first doses. So second clinic is your last best chance. I know that the decision to get the vaccine is highly personal, and maybe you still have unanswered questions. And if that's the case, I urge you to make sure to join one of our Ask the Doc sessions. We've had great feedback about these sessions. People who participated told us that they felt comfortable asking whatever they needed to, and they got the information they were seeking. Talk to one of our medical directors or one of your advanced practice providers in your center. Consult with your own doctor. Look up resources from the CDC or check the resources that we have posted on Genesis Central. Consult with your religious and community leaders, and also look to trusted coworkers and friends who have already gotten the vaccine. But please, make sure that you have a plan, because the second clinic is truly your shot to ensure that you'll get the 2 doses to help protect you and your loved ones.